All right, let's talk about something called Exocrine Pancreatic Insufficiency, or EPI for short. Now, I know that sounds like a mouthful, but we're going to break it all down so it's simple, clear, and a whole lot less intimidating than it sounds.
So does this sound familiar? You've got a dog who is just starving all the time. I mean, they'd eat the whole house if you let them, but for some reason, they just keep losing weight. It's confusing, right? And it's definitely worrying for any dog owner. I want to help you understand what might be going on because there's a common cause for this, and the most important thing to know is that it's totally manageable.
So what is EPI, really? At its heart, it's a digestion problem. Your dog's pancreas just isn't making enough of the special little tools, the enzymes, that it needs to break down their food properly. So even though they're eating and eating and eating, their body can't actually pull the nutrients out of the food. They're basically starving on a full stomach.
Here's an easy way to think about it. Imagine your dog's pancreas is a little factory. Its main job is to crank out these essential tools, the digestive enzymes. With EPI, that factory hasn't shut down, but it's having a serious production slowdown. It's just not making enough tools to get the job of digestion done.
So you're probably wondering, how does this even happen? Well, EPI doesn't just pop up out of the blue. There are a couple of main reasons why a dog might develop this, and they tend to show up in different dogs at different stages of life.
The big one, the most common reason we see this, especially in younger dogs, is something called pancreatic acinar atrophy, or PAA. We think this is where the dog's own immune system gets confused and starts attacking the very cells in the pancreas that make those digestive enzymes. Then you've got chronic pancreatitis. This is less common and usually happens in middle-aged or older dogs. It's the result of long-term inflammation that slowly wears down and damages the pancreas over time. Sometimes that damage can even spill over and affect insulin production, which can unfortunately lead to diabetes.
Now, while any dog can get EPI, we definitely see a genetic link. It's really common in certain breeds. German Shepherds are way at the top of the list. We also see it a lot in rough-coated collies, and several other breeds have a higher risk too. But just remember, this is just a risk factor, not a guarantee.
Okay, so how does this problem inside your dog's body actually look on the outside, in your day-to-day life? As a pet parent, you're on the front lines, and the things you notice at home are the most valuable clues you can give your veterinarian.
The classic sign, of course, is that weight loss we talked about, even with a crazy appetite. But what you're picking up in the yard is just as telling. You'll often see really large, soft stools that look kind of pale or yellowish, maybe greasy, and have a really foul smell. That's from all the undigested fat. You might also notice your dog is extra gassy, their coat looks dull or flaky, and some dogs even start eating weird things like dirt or their own poop.
This number right here is so important. It explains why EPI can feel like it just appeared overnight. See, the pancreas has this huge backup system. The signs, the weight loss, the weird poop, they don't usually start showing up until more than 90% of those enzyme-making cells are already gone. So the problem's been brewing under the surface for a while before you ever see a single clue. If you're seeing these signs, the next step is a trip to the vet. And here's the good news. Getting a solid diagnosis for EPI is actually really straightforward. This isn't some big mystery illness. We have some great, simple tools to figure it out.
The absolute best test for diagnosing EPI is a blood test called a CTLI. I know, another long name, but all it means is we're measuring something called trypsinogen in the blood, which is only made by the pancreas. In a healthy dog, the level is normal. In a dog with EPI, the level is super low. It's a dead giveaway. Your vet will just need to get a blood sample after your dog has fasted for a bit, usually 8 to 12 hours.
Now, another really crucial piece of the puzzle is vitamin B12. You see, the pancreas is also responsible for helping the body absorb B12. So when it's not working right, the B12 levels plummet. In fact, more than 80% of dogs with EPI are also deficient in B12, and that deficiency can cause its own set of problems. So your vet will definitely be checking that too.
Okay, let's talk about the best part, what we do about it. Once you have a diagnosis, I want you to know that EPI is not a dead end. It is an absolutely manageable condition, and the road to getting your dog healthy again is clear and effective. There is so much reason to be hopeful.
The cornerstone of treatment is simply replacing those missing enzymes. We call it pancreatic enzyme replacement therapy, or PERT. It's really as simple as it sounds. It usually comes in a powder that you get from your vet, and you just mix the right dose into every single meal. The powdered stuff works best, and you don't need to let it sit or anything. Just mix it in and serve it up.
Diet is also part of the team. While the enzymes are doing all the hard work, the right food can make their job a lot easier. We usually recommend a food that's easy to digest. You don't want anything too high in fiber, because that can get in the way of the enzymes. And a moderate amount of fat is usually good to help them get that weight back on. But every dog is different, so you'll work closely with your vet to find the perfect food.
I want you to really hear this. With appropriate management, these animals usually gain weight quickly, pass normal feces, and can live a normal life for a normal lifespan. That's the goal, and it's a realistic one. With the right plan, the turnaround can be amazing. They feel better, they look better, and they can go on to live a long, wonderful, totally normal life.
So if there's just one thing you remember from all of this, please let it be this. An EPI diagnosis can feel scary at first, but it is not a dead end. It's a condition we understand, and it's a condition we can manage. And that really brings us back to you, the pet owner. This whole journey starts with you noticing those little changes in their appetite, their poop, their energy. It makes you think, doesn't it? What small clues is your pet giving you about their health every single day?
Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.